Okay, Dr. Hall here. We're going to continue with lecture 30. We left off at the esophagus, and so we're going to pick up and go through just the next couple of organs, the stomach and the pancreas. So to review, we've so far talked about how the teeth and the tongue contribute to mechanical digestion, breaking up the food into smaller pieces, mixing it with the saliva, right? So that's mechanical digestion. And the saliva also contains salivary amylase, which begins the chemical digestion of carbohydrates. Saliva, you might also recall, has lysozyme, which kills bacteria. Then we talked about the esophagus, which is merely a transport tube, and it's made, the inner lining is stratified squamous epithelium to make it nice and resilient so you don't bleed when you eat potato chips. And then we have those muscular layers of the alimentary canal, right, so that we can squeeze and scrunch food down through the entire canal. We have that inner circular layer and outer longitudinal. And then we also talked about sphincters and that lower esophageal sphincter, which pinches off the top of the stomach and keeps acid from coming up into the esophagus, which is called reflux and can cause heartburn. So let's talk about the stomach. So we'll talk about Stuart. He's totally addicted to caffeine, drinks 5 to 7 cups of coffee per day, as well as caffeinated soda, right? Total addict. And then during exam week, he gets really stressed. He starts drinking more coffee and then also taking a lot of ibuprofen for headaches. By the end of the week, he has a terrible stomach ache. Anytime he tries to eat, he feels abdominal pain and nausea, so that now he can only stand to eat crackers and toast. Maybe this has happened to you. So this is a problem with Stuart's stomach. So the stomach is a muscular bag, right? It's a continuation of his alimentary canal located between the esophagus and the first part of the small intestine there. Here's our esophagus, obviously. And so it has that esophageal sphincter or lower esophageal sphincter at the top, and it also has a pyloric sphincter at the bottom. So you can pinch off the stomach and keep it closed at both ends. The other thing about the stomach that's different from other parts of the alimentary canal is it actually has 3 muscle layers. Additionally, it has these accordion-like folds called rugae, which then allow it to stretch outward, which is nice. So you can actually eat a nice big meal. So let's talk about its mechanical digestion contribution first. So I mentioned that the stomach is different because it has 3 layers. So similar to other parts of the alimentary canal, there's an outer longitudinal layer. Then deep to that, there's a circular layer, but then the stomach has an additional 3rd layer, an oblique layer, right? Oblique means diagonal, where the fibers are running diagonally. And this allows the stomach to mix and churn all the contents that are inside of it in lots of different directions. So the stomach is going to do mechanical digestion, churning up the food, mixing it with gastric juices, and then those contents, once it's all mixed with the gastric juices, are called chyme. So you'll see that word a lot as we kind of move through the alimentary canal from here on, right? So chyme. So 3 layers so that we can do lots of good mixing in the stomach. Now the stomach is not just going to do mechanical digestion, it's also going to do some, not all, chemical digestion. So if we look at the lining of the stomach, we see simple columnar epithelium right here. And so it's lining the surface, and then it dives deep in, covering these pits, right? These little chasms, right? And the lining continues down in there, and those are called the gastric pits. And in the gastric pits, we produce an enzyme called pepsin. And pepsin is going to begin the chemical digestion of proteins by breaking them into smaller polypeptide chains. So a polypeptide is still multiple amino acids linked together. So proteins, we have to really chunk it. So proteins get broken down into polypeptides, which eventually will get broken down into their constituent amino acids. So we start this process of chemical digestion of proteins in the stomach with pepsin. And in order to be activated, in order to work, pepsin requires a very low pH. So you have to have a very acidic environment to make pepsin, the enzyme to break down proteins, effective. The stomach is also going to absorb alcohol. So it's interesting, there are very few things that are absorbed in the mouth, and practically nothing is absorbed in the esophagus, but in the stomach, we have simple columnar epithelium, things can be absorbed, and alcohol is one of them. So alcohol is a very small molecule, it's nonpolar, so it's lipid soluble, which means it can move across plasma membranes quite easily. Now, if food is present and the alcohol is mixed in with your food, that's going to slow down the absorption of alcohol. So that's why oftentimes if we're talking with people about safe consumption of alcohol, we're encouraging people to not drink on an empty stomach, right? Because then you're going to absorb all of that alcohol really quickly, and that can be dangerous. So we want you to eat too. Now, interestingly, some people, especially young male-bodied people, do have an enzyme called alcohol dehydrogenase that's produced in their stomach lining, and it breaks down the alcohol into an aldehyde molecule before it gets absorbed. So some people have this ability to break down the alcohol before it even has a chance to get absorbed into their bloodstream, at least a portion of the alcohol, right? So that's why if you look at those kind of BAC calculation charts, or from personal experience, you might see that a male-bodied person, even if they're kind of the same general size and body weight as a female-bodied person, they can usually tolerate a much higher dose of alcohol without having the same effects. That's because they have this enzyme that's breaking it down, right? So they don't absorb as much of the alcohol that they are ingesting as someone who doesn't have this enzyme or doesn't have as much of this enzyme. So there's also a lot of genetic variation across the world in terms of how much of this enzyme people produce. So not just based on biologic sex, but also kind of your historical genetic ancestry. Often people who are descended from Asian countries, oftentimes they don't have alcohol dehydrogenase or very much of it. So everybody has a different tolerance of alcohol to begin with. And then of course, as we'll talk about later when we talk about the liver, maybe, I don't know, you can build up a tolerance to alcohol, but if you do, that's kind of a bad sign, actually, that you're drinking too much. All right, what else does the stomach do? The stomach does so many things. It also kills bacteria. If you think about it, we're all swallowing lots of bacteria we eat all the time, right? So from the food that we eat, dirt on our hands, stuff that's growing in our mouths actually have a lot of bacteria despite salivary lysozyme. So we don't want that to end up causing infections. So the gastric pits not only produce pepsin to begin the chemical digestion of protein, they also make hydrochloric acid, and that's going to kill most of the bacteria that we might ingest. It's super acidic. You might remember from chemistry class. It has a pH of 2, right? Really dangerous stuff. Now this acid also, you might remember, pepsin needs an acidic environment in order to be activated. So the hydrochloric acid is kind of getting 2 birds with 1 stone for us, killing bacteria that are present in our food, as well as activating pepsin. Now, of course, sometimes it's not able to kill all of the bacteria or all of the viruses, and so sometimes we still can get sick from things that we ingest. But if it weren't for our hydrochloric acid, we would get sick probably quite a bit more. So this acid presents a challenge to the stomach, right? So we don't want the acid to burn our stomach cells, just like it can in the esophagus if you have reflux. So we have a ton of goblet cells in the simple columnar epithelium that lines the inside of the stomach, and they make a lot of mucus. And this basically forms a layer. So here's your simple columnar epithelial cells here. And you've got your gastric pits here, and they don't show the cells, but here's your gastric pit. And so that's making the acid and the pepsin, right? But your simple columnar epithelial cells with your goblet cells are making mucus. So this area right here, this is all mucus. So it's like a slime layer that covers the entire surface of the inside of your stomach. This is why too, like, if you get a gastroenteritis, like you get a stomach illness and you're vomiting, how if it's towards the end and your stomach is pretty empty, all that comes up is like some bile and some mucus, right? But that's because you have mucus lining the inside of your stomach. Sorry, I know that's an unpleasant image. All right, so what's happening in Stewart, right? So normally you should have all of this mucus protecting your stomach lining, and you should have some acid and pepsin here kind of sitting on the top and working on the food contents, helping to turn them into chyme. So both coffee and soda are very acidic, which she was drinking a lot of. And interestingly, ibuprofen interferes with normal mucus production by the goblet cells. So you actually lose the ability to make a really thick mucus layer. So Stewart now has more acid and less mucus to protect him from it. So they kind of, I would have exaggerated it more, but you can see here we've got more acid and we've got less mucus. So that increases your risk of irritation and damage to your stomach lining, which is called the mucosa. The inner lining of all of the alimentary canal is called the mucosa. So this is what that would look like if you were to put a camera down into the stomach. So here's kind of normal. So this is an endoscopy where you take a fiber optic tube with a camera and a light, and you actually go down through somebody's esophagus and down into their stomach. Obviously, we're going to give them a little bit of medicine to relax them and alleviate pain, because otherwise you would be very uncomfortable. And what you can see in somebody who has irritation of the stomach lining is it just kind of looks all red and raw. And we call that gastritis. Itis means inflammation. Gast as in gastric, meaning of the stomach. Right? So poor Stewart has more acid and less mucus to protect him from it because of his ibuprofen use, and so he has developed a gastritis. Very common problem in young people, especially if they're taking ibuprofen for any reason. So what does the stomach do? A lot of things, right? So it's this muscular bag that contributes a lot to mechanical digestion and produces chyme by mixing up the food with the gastric juices. We also begin chemical digestion of proteins using the enzyme pepsin. We also have acid, which kills bacteria and also activates the pepsin enzyme. We absorb alcohol. And finally, it makes a chemical called intrinsic factor, which is something that our bodies need in order to be able to absorb a particular vitamin, vitamin B12. So our stomach does a lot of important things for us, aside from just chemical and mechanical digestion. But there you have it. So let's move on to the next organ. Let's talk about Pete. So Pete likes to party. On a typical weekend, he'll have 15 to 20 alcoholic beverages, so either bottles of beer, cans of beer, shots, what have you, per night for 3 nights in a row, right? So this is Pete. You've maybe met somebody like Pete, or you've certainly seen them in the movies. So just to put it in perspective, the average college student drinks 2 to 4 alcoholic beverages per week. That's the average, 2 to 4 per week. So if your intake is much higher than that, I'm really going to ask you to do some deep introspection about that, because then I'm worried it might be too much. All right, so one day poor Pete, he develops really bad abdominal pain, nausea, and vomiting. And he goes to the health center, and, we're in the know, so we get this alcohol, history of high alcohol intake, and we think, maybe this isn't just a regular stomach bug. And so we do some tests on his blood and find high levels of amylase and lipase. Now you see these ACEs? How those words end in ace, and you remember salivary amylase? These are enzymes. These normally shouldn't be at very high levels in your blood, and when they are, then we know you have pancreatitis, which is inflammation of your pancreas, and this is a potentially serious problem. So he actually gets admitted to the hospital to be treated. So what is the pancreas? So if we zoom in on somebody's abdominal contents, right, so they've kind of taken the square and magnified it and then made things a little bit see-through. The pancreas is this funny looking gland that sits kind of behind the stomach and nestles into the curve of the first part of the small intestine, which is called the duodenum. All right, so that's where she's located. What does it do? So the interesting thing about the pancreas is it has both endocrine and exocrine functions. So endocrine means that it's part of the endocrine system, which you might remember is our hormone system. Remember when we learned about calcitonin and PTH way back on the skeletal system? So endocrine system is the system of hormones that travel through the bloodstream. Right? So the pancreas actually makes a hormone that travels through the bloodstream, in this case insulin, and insulin is the hormone that goes to all of our cells to help them regulate blood glucose levels, to allow the cells to get glucose in, because you might remember it's facilitated diffusion for glucose, and that is really important, as anyone who's been diagnosed with diabetes knows. Now, exocrine functions are, instead of making a hormone that you secrete into the bloodstream, you actually make an enzyme or another product that you secrete through a duct to another region. So in the pancreas, and we have all these different regions, way out here is the tail, then the main part is the body, then this is the neck here, and then we have the head of the pancreas. But there's this duct, which is going to then allow the pancreas to secrete things into the small intestine, or the first part of the small intestine, which is called the duodenum. So in the case of the pancreas, the things that it's going to secrete through its duct are digestive enzymes. But you couldn't see that coming. So this is one of those accessory organs. Food does not move through the pancreas. It is not part of the alimentary canal. It's an accessory organ that's going to make enzymes and squirt them into the first part of the small intestine to help us digest our food. So it's going to make 4 main enzymes that I want you to know about. Trypsin for the chemical digestion of proteins, amylase. Now this time it's pancreatic amylase for carbohydrates. Remember we had salivary amylase in the mouth. Lipase to digest lipids, and nucleases to digest nucleic acids, right? So if you look at that, the pancreas makes enzymes that will digest, chemically digest, all 4 classes of organic molecules. Right? These are the 4 molecules that everything that we eat is made out of. These are the 4 types of molecules that everything we are is actually made out of as well. Additionally, the pancreas is going to make some sodium bicarbonate, which is basically baking soda that will neutralize the stomach acid as the chyme enters the small intestine, because the small intestine doesn't have that thick protective mucus layer that the stomach does. So we need to make sure that we neutralize that acid as the chyme enters the small intestine. So pancreas is super duper important. You cannot live without one at this stage, although people are working on trying to make a synthetic one. And so for poor Pete, when your pancreas gets inflamed, what happens is that those digestive enzymes leak out and onto the nearby organs, which you might remember are your stomach, your small intestine. There's some really big blood vessels that are there. And so what happens is you start digesting your own body. So pancreatitis is really dangerous. It has a mortality rate of 5 to 10%, which is actually very high for a medical condition. And these can be caused by high alcohol use, gallstones, which we'll talk about in our next lecture, certain types of high cholesterol, and certain medications and drugs. But in your age group, by far, the most common cause of pancreatitis is excessive alcohol intake. So in this lecture so far, we've gone all the way from the mouth down to the stomach and the pancreas. So just to review these new parts in B, so the stomach has those 3 muscle layers, because we have not only the outer longitudinal and then deep to that. This time it's the middle circular, but we have an inner oblique, and we have glands to produce acid and pepsin, and goblet cells make a mucus layer to protect. So the hydrochloric acid will kill bacteria as well as lower the pH to activate pepsin. Pepsin will initiate the chemical digestion of proteins. Then we talked about the pancreas, which is this gland behind the stomach that has both endocrine and exocrine functions. The endocrine function is production of the hormone insulin, which it secretes into the bloodstream, and its exocrine function is to make those four major digestive enzymes: trypsin to begin digesting proteins, amylase for carbohydrates, lipase for lipids, and nuclease for nucleic acids. All right, so we'll pick up next time by starting to talk about the intestines and the liver and the gallbladder.